I know that you work with me, you're one of my colleagues, but I was just wondering a little bit about your journey in nursing, how long you've been nursing and what got you into the job.
I've been with the Holyhead team now for about 2 years. I was quite late to my training. I did my pre-nursing when I left school and then went on a different route and came back to it in my 40s after my kids and things had grown up, and found during my training that community nursing was my passion.
Oh, bro.
What about you?
Whew. So I then thought I'd work in healthcare. However, I got a job as a community care assistant and found I absolutely loved it. Moving on from that, I became a call handler for the ambulance service, and I realised I absolutely loved that too, but it just wasn't quite enough. And then I found the nursing degree, and from putting my feet into the university, that has been it. Nursing has been my career. And like yourself, as soon as I went out on placement in the community, I realised this is definitely what I want to do. And primary care is the way forward for me.
Yeah, and I think both of us being fairly newly qualified when COVID hit, things changed dramatically. What do you think the public thought?
Well, I know what I thought as well. I actually got my PIN the day the country went into lockdown. So I was fully thrown in the deep end when it came to the COVID crisis, the pandemic. I think the public looked at us straight away. No one knew what was going on. We never had to deal with anything like this before. And I think, rightly so, the media looked towards the NHS as to what you're going to do. And so in turn, they looked to us, to the nursing force. And it was scary. I think it was scary for us and for the public at the same time, because like I say, no one knew what to do. But I think nursing then became to the forefront of people's minds because it was a health need, and they needed to look at this. And I don't know about you, I wasn't too convinced that the media portrayed nurses in a realistic manner throughout the whole of the pandemic.
I don't think they portrayed community nursing properly. The focus was very much in the hospital, and I don't think people really knew what we were going through in the community and the challenges we faced with services suddenly being reduced and trying to fight our way through surgeries and things being locked up suddenly, you know, and then having the change in work where we were screening patients. You're going quite blindly really into somebody's house, even though you've done the screening, whereas in the hospital setting, it's more clinical. So things like that were quite different, I think.
I agree with you there, especially learning how to do PPE in the community was so different. In hospital, there was more of a systemic approach. You had your PPE, say, by the beginning of the ward and things like that. But when you're going into people's homes, it's quite different of trying to make sure that you're doing it correctly, that you're donning your PPE and you're disposing of it in the right manner. I think that was a lot for everyone to learn. And we said this is the first time anyone's been in a pandemic, so we're wanting to protect our patients and protect ourselves. No, I think I agree with you as well that we've seen more complex cases of patients because surgeries have been closed, because services were postponed or reduced. I think as nurses, especially, you know, obviously we talk more about community nursing because that's what we do. We've taken on a bigger role in healthcare now.
Definitely. And we've learned quickly, I think, how to adjust. Like I say, because services haven't been there, we've had to work in a different way and take on more complex cases that would possibly have gone into hospital that we've kept at home and tried to work through and do the best for the patient.
Do you think that it's recognised the extra work that we've put in by the public, and do you think we're valued for what we've done throughout the pandemic?
I don't necessarily think that community nursing has been at the forefront of people's minds. They just a lot of people associate nursing as going into hospital and the hospital side of things. They don't see nurses so much in the community as maybe a profession that I suppose most people aren't dealing with the community nursing, are they? Their first port of call is a hospital or the GP surgery
Yeah.
to see their practice nurse.
It's been so difficult as well accessing GP services because everyone's trying to do what's best for the patients as well. And I found personally that obviously we're all trying to keep our distance throughout this pandemic. And it's become harder to be able to access the normal services and work with the different professionals that we've normally done. Worked with these where we could normally just pop into our surgery and ask for prescriptions to be signed. Suddenly there's different policies and procedures in place. But I think as a team and as a community force, I think we've really pulled through with this, and I think we've really come together and our communication skills have had to adapt, and I think our recognising more complex needs has adapted very well.
Definitely, and I think as the COVID now is, situations are changing with less cases. Our situation is changing more, and our workload is becoming more now as these complex patients that have left from COVID are coming into the community and needing our services.
Do you think as well with the rise in our complex patients, do you think that nurses are paid fairly?
Before COVID, I'd have probably said yes. But then I think the longer you work and you see the challenges that we face, you realise how complex our learning is and how we have to keep on top of everything and learn new skills or adapt constantly. And I don't think that is recognised in the pay.
I think something that can be forgotten, and this is through no fault of anyone's, everyone's gone through this and everyone's experienced the pandemic differently, is that as the lockdowns are starting to ease, our caseload is not easing. We have worked throughout the pandemic tirelessly, and like you say, we've had to adapt and learn new skills. Whilst we've had staff shortages and higher pressures, we've had to learn more. We've had to become not only community nurses, but we've also had to take on little bits of different roles from other services to make sure that the patient is completely looked after and patient care is still at the centre of what we do. And I think with that in mind, I think we do deserve to be recognised for our efforts and to be paid accordingly. Over the last 10 years, our real wage has actually decreased in value. So in essence, we're getting paid less now than we were 10 years ago in line with inflation. And especially with what's happened over just over a year, it does feel like you are not valued and you're not being treated as fairly as you would like. I don't think it's that nurses are standing there and saying, we have done this, we have sorted the pandemic, or, we are the heroes, as was one of the terms that was thrown around. I think nurses are just standing there, they are tired, they have not had a break, and they continue to work tirelessly, and I think they just want to be recognised for that.
Definitely. Yeah, totally agree.
That's me on my soapbox. Oh, lovely. Is there anything, do you think, that you will get involved with then, with the RCN Fair Pay campaign?
It's definitely something you've highlighted and I would like to look into more. So, yeah, I'll get some more information from you.
I think I'm on Twitter. I don't know how your socials are, so I think I'll be following more on Twitter. I'll also be looking at local events as well. In relation to fair pay, which I'm sure you'd love to come along with me now. And I think between us, I think it's an issue we both feel strongly about, and it's something that we can highlight to our team as well. And I think more people that talk about it, the more it will be recognised.
Yeah, that's true.
This has been lovely. Got out of working for a little bit. Thank you for talking with me today, Gav.
Thank you for chatting.